All right, Martin, I'm going to come to you. I see your head. You're nodding your head. So
Shaking
I'm gonna come to you for a response there, but I want to move on here for a quick second. Martin, Ford has repeatedly stated that the status quo isn't working, and even went so far as comparing Ontario's healthcare system that to Cuba and North Korea. I think a lot of that has more to do with the country's politics than anything. Is there a fair argument there? Is it really that bad?
I don't think we're part of an axis of evil, if that's what Doug Ford was suggesting. So no, it's not that bad at all. It's pretty good, but it's not fantastic. And there's a myth in Canada that there's this cult of Medicare that we have, it's evolved to the highest level, that we are the model of the world. And we forget, yeah, we're a lot better than the Americans, but we are behind, way behind the rest of the West. Countries with universal public health care systems, we spend far more per capita as a percentage of GDP on health care than virtually any other country, developed country, with a universal public system such as we have. I said public. I want to just, for the record, give people some context. Forgive me. But because Natalie has said it's a public system and her press releases, which I get, say Canada's public Medicare system. It is a system that is required by law to be publicly universal and publicly accessible. It is not a public delivery system. So you go to the lab for your blood test, you get your x-rays for the minor stuff, like I say minor, when I have a broken ankle or a broken knee, I won't call it minor or a sprain. It's at a private lab. You know, colonoscopy clinics can be private labs. And so I agree with Rose that taking things out of hospitals is not a bad thing. And so Natalie said that we are effectively cherry picking, that the profiteers will be scooping up the best, juiciest cherries from which they can skim the best profits and leaving the tough stuff for the hospitals. And you're nodding, but that's exactly what the doctors want. That's what the CEOs of all the major hospitals want. They want to parcel out the stuff, the low-hanging fruit that I talked about earlier, because, and I don't want to suggest that these are factory farms, but I think I forget the word you use, but it's something you can systematize it. My words, you can streamline these procedures. Everybody knows now that with cataract, you can actually make it a lot faster than it used to be. So that's, I'm sorry, I got off on a tangent there, but I think what we need in the debate is context, was my point. And I've forgotten your original question, Jay. I'm sorry.
That's right. It was about whether or not we had a really bad health system in comparison to North Korea and Cuba. But
so I think we're better. I think we're actually better than North Korea and Cuba. You can tell the Premier I said that, but I actually think we're not as good as we think we are. And so we need and I think a lot of patients and a lot of doctors know that. And that's why, and I'll stop in a second, but that's why we had something called hallway medicine. Remember hallway healthcare? 2018 election was fought on that. It's one of the reasons Doug Ford won and the Liberals lost, because the Liberals gave us hallway healthcare. Actually, a flu surge, a couple of flu surges gave us hallway healthcare, and then a pandemic, who knew that was coming, gave us a lot worse. We had a huge disruption, and that's why people are trying to figure out how to do things a little differently.
I'm going to stick with you just because you brought up the campaign there. It's, Doug Ford was reelected in 2022. I heard about highways. I did not hear about this. Why didn't Ford campaign on this on his platform?
Probably he was afraid of the reaction.
Well, he did the opposite. In fact, their spokespeople swore up and down they were not going to do this, because we held 20 press conferences warning that they were going to do this after the minister kind of misspoke and said in a press conference that they were going to expand the private hospitals and clinics. And they literally sent a spokesperson out after us, after every press conference, and denied up and down categorically, leading into the election, that they were going to do this. And then 2 months after the election, they moved forward with doing it. I mean, it is profoundly undemocratic. They have no mandate, zero mandate to do it. That's clear.
So to your question, politicians do that all the time. And should every politician be upfront and transparent about what they're going to do? Yeah. But I also think the rest of us who are, as a journalist, I can be ideological about this. I like public ownership. I mean, I wish the post office was still run. I almost wish that, I used to think I wish there weren't postal boutiques in Shoppers Drug Mart, because I always thought that our friends at the Canadian Union of Postal Workers should not lose their jobs. But you know what? Those boutiques in the Shoppers Drug Mart are pretty handy now for getting my parcel from Amazon or whatever. And so I just think we also need, just like politicians, to be honest, I think we should have, And just like doctors should be transparent in billing, and the doctors who run these clinics, for profit or not for profit, which also transgress transparency sometimes. Sometimes the hospitals don't tell you about the upselling that people talk about, which is not extra billing. Upselling is not extra, we can talk about that. So I think everyone should be honest in this debate, and not just the politicians.